Ever wondered how your interaction with animals and the environment might be affecting your health? Let's dive into the intricate relationship that exists among humans, animals, and our shared environment. This interconnectedness is a complex web of interactions that, when disrupted, can lead to exposure to diseases and increased susceptibility. Consider this. When we alter our natural environment, whether it's through deforestation or pollution, we inadvertently create conditions that can favor the emergence and spread of disease. We disrupt the habitats of animals, forcing them into closer contact with humans. This close proximity can facilitate the transmission of diseases from animals to humans, a process known as zoonosis. Now let's talk about animals. From the pets we keep at home to the livestock we raise for food, animals are an integral part of our lives. However, they can also be carriers of pathogens that can jump to humans, causing diseases. This is not just about wild animals. Even our beloved pets can carry ticks, fleas, and other parasites that can transmit diseases to us. It's not all doom and gloom, though. Recognizing this interconnectedness is the first step towards mitigating these risks. This is where the concept of One Health comes in. One Health is an integrative effort of multiple disciplines working together on a local, national, and global scale to achieve optimal health for people, animals, and the environment. It's about understanding that our health is intrinsically linked to the health of animals and our environment. So, when we talk about preventing and controlling diseases, we're not just talking about developing new vaccines or medications. We're also talking about protecting our environment, promoting animal health, and fostering healthier interactions between humans and animals. Because at the end of the day, we're all sharing this planet. Our health and well-being are intertwined with that of the animals around us and the environment we live in. Understanding this connection sets the stage for a deeper understanding of the natural history of diseases. What if I told you that diseases often start long before the first symptoms appear? Yes, you heard that right. Welcome to the world of the preclinical phase of disease, a crucial part of the disease timeline that often goes unnoticed. This phase is like a stealthy cat, silent but deadly. It's the period when a disease has already begun its destructive journey inside the body, yet it's not yet clinically manifest. Imagine a ticking time bomb, silently counting down with no visible signs of the ensuing chaos. That's the preclinical phase for you. So how does it work? Well, during this phase, the disease is already setting up camp in your body, making itself at home. It's like an uninvited guest who sneaks in, starts rearranging the furniture, and you don't even realize it till they've made a mess. Now, here's the tricky part. Even though the disease is already at work, the patient does not recognize any problem. You may feel in the pink of health, blissfully unaware of the silent battle being waged inside your body. The disease is present, but the symptoms are not. But here's where modern medicine steps in. During the preclinical phase, diagnostic tests or examinations may be positive. Yes, even when you're feeling perfectly fine, it's like a secret code, a hidden message that only medical tests can decipher. These tests can detect abnormalities or changes in the body that indicate the presence of a disease. It's like having a secret detective on your side, sniffing out the clues and piecing together the puzzle before the whole picture becomes clear. Why is this stage so important, you ask? Well, early detection in the preclinical phase can lead to early intervention, improving the chances of a favorable outcome. It's like catching the thief while he's still plotting the heist. So, the next time you go for a routine checkup, remember, you're not just ticking a box. You're potentially catching a disease in its preclinical phase, giving you a head start in the race towards recovery. Unseen and undetected, the preclinical phase can be a silent time bomb. But with vigilance and regular checkups, we can diffuse it before the timer runs out. When does a disease truly become a disease? When it starts affecting our daily lives. This is the essence of the clinical phase of disease, the period when the disease is clinically apparent and the individual usually recognizes something is wrong. In this phase, the body and the disease are engaged in a fierce tug of war, each trying to outdo the other. The disease, having successfully invaded the body during the preclinical phase, now begins to manifest itself through a variety of symptoms. These symptoms can range from mild discomfort to severe pain, depending on the nature of the disease. But what about those instances when a person is infected but shows no signs or symptoms? This is what we call latent disease. In this scenario, the disease is present in the body, silently working its way through the system, but the individual appears healthy on the outside. This is particularly dangerous because it allows the disease to spread without detection. For example, consider tuberculosis. A person with latent tuberculosis is not sick and cannot spread the disease to others. However, if left untreated, the latent disease can advance to active tuberculosis, which is both symptomatic and contagious. Now, the clinical phase of disease doesn't just involve physical symptoms. There's also a psychological component to consider. When a person realizes they are sick, it can lead to stress, anxiety, and other mental health issues, and these, in turn, can exacerbate physical symptoms, creating a vicious cycle of illness. The clinical phase also marks the point at which medical intervention becomes critical. It's the stage where the healthcare system steps in, diagnosing the disease and prescribing treatment. This could involve medication, lifestyle changes, or in some cases, surgery. And while all this is happening, the body's immune system is always at work, fighting the disease from within. It's a complex and fascinating process, one that demonstrates the incredible resilience of the human body. The clinical phase of disease is a battle between the body and the disease, often with the patient as the battleground. But remember, this phase is not the end, it's just another step in the natural history of disease. Every story has an end, and so does every disease. This finale, in the world of epidemiology, is referred to as the resolution phase. It's the moment of truth, the part where the disease either leads to recovery or, sadly, in some cases, death. The resolution phase is a complex process influenced by a myriad of factors. Let's start with the patient's immune system. A robust immune response is crucial for recovery. It's like a battalion of soldiers defending a fortress. Without a strong defense, the invading pathogens could easily overtake the host. Next, let's talk about the pathogen's virulence. That is, its ability to cause disease. Some pathogens are like stealthy ninjas, adept at evading the host's immune system, while others are like brutish warriors causing extensive damage. The virulence of the pathogen plays a significant role in determining the outcome of the disease. But we can't forget about the effectiveness of treatment. From antibiotics to antivirals, from vaccines to supportive care, the arsenal of medical interventions can significantly tip the scales in favor of recovery. The right treatment can help the immune system in its battle against the pathogen, and can even neutralize some of the most virulent invaders. However, the resolution phase is not just about surviving the disease. It's also about the aftermath, the lingering effects that can continue to impact the patient's life. Some survivors may fully recover, returning to their pre-disease state, while others may experience lasting health issues, from chronic fatigue to organ damage. This is known as sequelae, the long-term effects of disease. And that's not all. The resolution phase can also have psychological implications. Surviving a severe illness can lead to mental health challenges, such as post-traumatic stress disorder. This underscores the importance of holistic care addressing not just the physical, but also the mental and emotional health of patients. The resolution phase is not just about survival, but also about quality of life. So as we navigate the complex world of diseases, let's remember to look beyond the immediate battle, to the aftermath, to the survivors, and to the quality of life that we all strive for. Why should we delve into the dynamics and natural history of diseases, you might wonder? Let's take a brief recap of the voyage we've embarked on in this video to find an answer. Our exploration launched with the mutual relationships among humans, animals, and the environment. This complex network of interactions serves as the setting where diseases arise and multiply. Imagine it as a massive theater where the drama of disease enacts, each character adding to the narrative in their distinctive manner. Subsequently, we plunged into the preclinical stage of diseases. This stealthy mode is when a disease quietly settles in the body, unknown to its host. Grasping this stage is critical, as it provides the optimal opportunity to halt the disease before it causes destruction. We then moved on to the clinical stage of disease. This is the moment when the disease steps out from the obscurity, making its existence known through symptoms. This is the stage where we, as healthcare practitioners, are often first summoned to the scene. It's also a crucial time to comprehend, as it allows us to study the disease in its full manifestation, understanding its properties and tendencies. We additionally discuss the resolution stage of disease, the concluding act of the drama. whether it concludes in recovery or demise. This stage offers priceless insights into the disease's ultimate effect on the body and the efficacy of our interventions. So why should we delve into the dynamics and natural history of diseases? Because it assists us in forecasting disease progression, devising effective remedies, and applying preventive steps. It enables us to perceive the larger picture, to understand not merely the disease, but the individual it affects and the context in which it thrives. Ultimately, diving into the dynamics and natural history of diseases isn't just about battling diseases, but about promoting health and well-being for all.